Okay.
So we have already separated our command structure into 3 silos. I'm going to be at the 911 center for the duration of this whole crisis. Harry Porter, Deputy County Executive, is going to be out at a government center, and Dan Bloomer, our Director of Operations, will be out at a fire training center. The 911 center and fire training center are now locked down, where the same people that come in there every day are coming in and out. We're not going to just allow visitors. The same thing is going to probably be happening at the government center. We have a little bit of difficulty because you have the grand jury, which is still in existence. If the governor changes those rules, like they did after some other tragedies like 9/11 and things like that, but right now we do have some offices that do need interaction. We do have people being arrested still. We still have those type of operations. Along with emergency operations, Brendan Casey's here with me. We've had a representative from each of those main divisions, the command structure, at those 3 locations to make sure that if we get sick, they can maintain operations. The sheriff's office is also in a very forward-leaning posture, not allowing people in, not allowing visitors to the jail for the most part, and keeping a very big hygiene factor on top alert. My biggest concern right now, besides people getting sick in the community and having test kits and hospital beds, is the nursing homes. And I'm also concerned about people that are being laid off right now. The single mom that's a waitress that is not getting a salary or her tips that she gets every week. So I am working with the Orange County Chamber of Commerce, a lot of our department heads here, economic development, jobs, to make sure that those individuals get that rapid check for unemployment or from their employers. There's a lot of questions out there on how it works, so we're bringing all those people in, even if they're remotely, to be able to answer those questions. I did a town hall last night. It was off the charts with the amount of people on it. Over thousands of people were on that call, as well as Facebook Live, asking a ton of great questions. Besides the normal coronavirus questions, they were asking, how long do we think this is going to be? How long is school's going to be closed? Because right now my order's for 2 weeks. We anticipate that going for at least 4 weeks. So you take it in for another week after the 2 weeks, and then that rolls into the natural spring break that some of these schools have. So now you have a 4-week off. I have a conference call tomorrow morning with the school superintendents. I am briefing the superintendent of West Point in 15 minutes. We're keeping very close contact with them. If you look outside of our talk right here, you have representatives from West Point, healthcare facilities, as well as emergency management people out there manning different desks out there. So we have people, volunteers, nursing and medical students handling calls. So we have a great relationship with people out there that have stepped up. You also have people from the school districts have offered up some of their school nurses to help do this. The other concerns I have is making sure that seniors and the veterans, that we deliver meals. Over 1,000 seniors and over 200 veteran families are getting meals every week. As of Friday of this week, they're going to have 5 days supply of food. And for both, we're also keeping tabs with the food bank to make sure that they have stocks. And if they get low, I can take emergency action to get them replenished. And been in contact with the supermarkets. Supermarkets have the stores, the storage to restock their stores, but the people are buying in just mass quantity. So West Point's commissary, as well as a lot of the supermarkets, are limiting the amount of goods that people can buy for what a normal family would have. So we haven't had to take any steps to enforce that, but we are on the ready, and we have talked to our local municipalities if they need to send a local police officer to make sure that those stores are good. For the most part, everybody's been very cooperative. But they are, within a day or two, supplies behind. 1 day on dairy, a few days on beef, and maybe a few extra days on cleaning supplies and toilet paper. But they do have the supplies, it's just people are taking them off the shelves.
Are you considering any other orders?
I am considering orders to probably shut down more operations in county government to just non-essential, sending non-essential staff home. That'll probably be done by the end of the day today. But again, I do need some people. Like I do have child protective services. I need to make sure that those kids are protected. So I need a lot of staff. My secretaries in the county exec's office are fielding mass calls. I need to keep those communication lines open. We will be shutting down, like I mentioned, some offices, like maybe the Office of Planning and things like that. They don't really need to be hearing planning board cases and looking at maps and projects. We could send those folks home. A lot of people
And they can work from home?
They can work from home, and we have the IT capabilities of doing that now. Probation is able to handle their job by remote as well in this instance for most of their cases.
Do you have the authority to close Woodbury Common?
We are working with the state on that. The same thing with the Middletown Mall. We can, and that is under consideration right now. Every day we see more orders coming down. So the governor, yesterday we had a problem with the town of Palm Tree. They have 100 schools there. They weren't able to comply, and they were working with us as well. But some of their school districts were saying, well, Rockland County and Brooklyn don't have the same rules that I'm putting down, and they wanted to see it universal, saying, look, you got to order everybody to shut down. Some of them are not complying. They are now doing that now. Now you have a universal rule that affects all the communities. So if I can't order the rule, I've been asking the governors for support. They've been very receptive to us on it. Same thing with helping us get some clarification for the hospitals so their workers could come back to work to do things. So they've been very cooperative with us.
Is that something that you want, the state to close shopping malls?
I don't know about, I think people still need to be able to get goods, and now we're looking at a massive shutdown, but the big premise is to try to nip this virus in the bud, and you nip that in the bud by having people stay home and not interact with each other. So that's why you saw, I think Sunday night, Dr. Gelman drove home through on her way home and saw bars packed. That's not a good thing to do, and I get it. People want to celebrate and do things, but that you can do that after this thing is over. And that's why you saw these restaurants. We also are very cognizant of people wanting to still buy food and from restaurants. So that's why you saw that rule come down that you can order out, take out from any of these restaurants.
How many of the 18 confirmed cases in Orange County are hospitalized?
I can't answer that right now. And I'd have to, I get an official report from Dr. Gelman on HIPAA violation, the privacy. But her big take and health commissioner's take is to make sure that people say, okay, there was a case in this town or this village. If I avoid that town or village, I'm good to go. That's not the case. We want people to be conditioned that no matter where you are, and the more you interact with people, the more chances you are of contracting this virus. So if you can stay home, stay home. If you can work from home, work from home. If you can avoid people and schedule your meetings via teleconference, do that. We're in contact with Stewart Airport. They're on the skeleton crew. If you don't need to be at these places and you can handle some of your critical operations remotely, do that.
Well, many of them were sent.
Brendan, what are your biggest concerns from an emergency management standpoint?
Well, supplies are always an issue, and I worked in the state for 30 years, so I understand they have to prioritize where a lot of these things go. So we've had requests in for several weeks now to make sure we have enough N95 masks and personal protective equipment for first responders and to supplement our healthcare providers. So that supply chain has not been as robust as I had hoped. So we have orders in, orders are trickling in, but we are behind where I hoped we would be with those supplies.
At this time, do all emergency responders have masks?
We are distributing additional masks today. I would say not every single one of them has the N95 at this point. So we're trying to look at what we can give out to police, fire, and EMS. We have 1,500 that we're going to distribute today, and my deputy commissioners are working on who needs them, who we didn't give them to already, and to make sure they understand how they're best used. I mean, if you get a guy that the police arrest and he says, hey, I've been exposed, I think I have this, the better use of the mask is to put it on the person being arrested rather than the 4 police officers. So we're trying to explain that to them. They understand what's the best use of it, when it should be used, and to make sure that they understand there's a finite resource on these things, and we have to be conservative with their use and use them properly.
And we've been having a daily call with first responders. So yesterday, fire, police, EMS, what do you need? And they have the proper representatives through Commissioner Casey. Town supervisors, mayors, every day now we do a conference call to keep in a loop. I'm in constant contact with Mayor de Blasio now, as well as Governor Cuomo. And yesterday we did a call with the White House. And we haven't sounded the alarms yet, except for a couple cases where we needed help with some of the hospitals, as well as some PPE. If we start getting low on testing kits, we're concerned about that, but we're hoping that the Anthony Wayne testing area, which is under construction right now, will be operational as they expected for tomorrow. That will relieve a lot of stress to the hospitals.
Are people complaining that they want to be tested but they can't? They're
Right
being
now,
refused tests?
I've been on the phone with Joan Cusack McGurk from St. Luke's, as well as Bon Secours and ORMC. Right now, I mean, I know how many people are being tested every day, so as long as they have those test kits and they meet those criteria, that the symptoms for coronavirus, we're being told that they're being tested. So I have not physically, and I will not be visiting the hospitals unless I get sick myself. So as far as we're concerned, the hospitals are testing the people that they need to be tested. I believe that if they had more tests, they'd probably be helpful, and I think that this is a national crisis. We're seeing this on TV, and our other county executives are experiencing the same thing. But those supplies are coming in, and again, once that operational testing area goes online in Anthony Wayne recreation area, it's going to be a big.
But I think an important message to get out is, for people who are feeling symptomatic of flu-like symptoms, it's really not important for you to know what strain you have. If you can stay home and you're not critically ill, stay home, treat it like the flu, don't present. There are people who want on-demand testing. There's a number of problems with that. Number one, it's a 2 to 14 day incubation period for this particular virus. So if you felt you were exposed and a day later you wanted to get a test, it may come back negative. But that doesn't mean that it's not inside you incubating. So you have to, if you're just feeling some mild symptoms, stay home. You'll self-resolve, and you won't overburden the medical system.
And this is why that incubation period and that time period for 10 or 12 days is why we have cut the county government into 3 silos to protect that.
Last question. Are you going to be able to get the at-work workforce down to 50% or lower?
I think so. I mean, look, everything is kind of flexible. Some of them are orders and flexibility, but if I need to bring in additional people to get the job done, I got to get the job done. I'm very concerned about my public here. I'm concerned about kids that are under my child welfare with the Department of Social Services. I'm concerned about getting meals delivered. Right now we have good plans in place. We have people helping up. The town supervisors have been great. We have dial bus operations going on. But once those programs shut down, and you need to get food to senior citizens and prescription drugs to people, I might need additional people, but at this point, we're okay.
West Point needs you right here.
Got it. Oh, we're right here or in his
Right
office? Okay.
Ask this gentleman, it's Chris, and then
What else should I know?
Really the message, and then we kind of finished up last night with the Facebook Live event and the Teletown Hall, is everybody's under a tremendous amount of stress right now. So understand that when you're dealing with people out there, if you're at the supermarket, check on your neighbors, be compassionate. Please be smart with your purchases at the supermarket. There's really no reason to hoard. We speak to the food suppliers on a daily basis. There's no indication that the supply lines have been interrupted. Supplies are coming in steadily. Please don't hoard or buy things that will last you a year when other people can't get things. So understand that the community has to work together on this, and hopefully in a couple weeks, Doc is saying 4 to 8. I'm hoping for 4. We can kind of see this thing start to flatten out and we get back to normal.
But we have Jim and Brendan in, and we'll be able to meet our needs. And Brendan will work from home. Jim will be working the office here if we need to.
So are you just starting that today? Have most people been showing up to work?
A lot of people have
normal?
stayed home. We have a liberal leave policy like we do during the snowstorms. But we've had a lot of people stay home because when you shut down schools, public and private, that requires a parent to be home. So we've lost people there. We also have people that have taken time off, but this is going to really codify 50% or lower to stay home.
Okay. So today's the day you're starting to tell people, those who can work from
And
home,
like
to do
right
so.
now, DMV is open, Department of Motor Vehicles. So when your driver's license expires, it expires on your birthday. So the state needs to relax those rules. So if somebody has an expired license for 30 days. If a cop pulls you over and it expired today, they got to give you a break on it, because then we don't need that traffic to come to the county clerk's office. But either way, we're going to start shutting down these operations.
Yeah, and just making sure that the people that need laptops are getting them. They can operate out of their house, kind of coordinating that department by department, and making sure, you know, what's our critical staff, what's our critical functions, and do people have the tools they need to operate remotely. So we've been in the process of doing that. It's just, you know, making sure that everything's handed out, logged in, you have this laptop signed for it, this is what you're going to do. So it's a process, and the CSEA and the workforce has been great. I think everybody understands this. If we don't get in front of this, it could be a big problem. So everybody's really pitching in on it.
People ask, like we had a teletown hall, we've had some people ask, is this fake news? Is this being overblown? And again, the most critical thing is 15, like right now we're at 17% of people that get it in New York State are hospitalized. And yesterday, the day before was 19%. That's roughly 1 out of 5 people has to be hospitalized. We have a limited amount of hospital beds in Orange County, as well as the rest of this country. That's what happened with Italy. They had to make decisions at that point in Italy. Do we treat an older person that has a less chance of surviving this, or a younger person? We don't want to go there. That's why we're trying to get people stay home, and if you don't feel good, call your doctor. Don't roll into the doctor's office and tell them after you showed up. So these are very basic procedures. If we follow them, we're going to be able to weather this storm a lot easier.
What places are still a concern? The
Nursing homes, any places that have to have people, nursing homes, the prison, any churches, most of them have closed, and synagogues and schools. So when you have those mass gathering areas dissipated, we're in good shape. But there's some places you can't avoid it, like the nursing homes.
Are there any other public gathering places where people are still, where there's
Not
you're still
really
worried about
anymore.
the density of people?
Not really anymore, except for the places they have to be like nursing homes. I got to do a briefing with the general, and I'll be back.
Okay.
Thanks, guys.
We have our medical providers. There's probably, I'd say 15 or 20, depending. You know, that was the other thing we did, which we've never really had a situation where we asked all the health providers to provide a liaison into the EOC. So all of our major hospital groups and our medical groups are providing a liaison, so we can kind of have that one-to-one contact. They can call their staff, let us know what's going on with their particular institute or their hospital. So it's important.
Dr. Gelman mentioned something about a medical reserve corps.
Yep.
Volunteers. Are they?
They're here.
Are they
yeah.
in that room?
Yep, there's a couple of them in there. We activate them for various drills. They come and help out. They can answer phones. Some of them have varying medical experience. And we have the medical examiner in this building, so we have 2 doctors down in the basement too that we can draw up in here if we need to have additional MD experience.
Okay. The call takers are in there, are not the usual 911.
No, these are the
call takers.
health line question. You know, they normally would be at health, but this is set up more like a call center. So, and then we have the ability. We have 2 classrooms here, so we can turn one of the classrooms into a call center also. 911 is separate. That's a separate area. It has a separate air supply. It's all its own thing on the main floor of this building. So there's no reason for us to go in and out of there, and that the building was built that way.
Okay. The calls that the health department call takers are taking, what are they by and large?
You know, the calls, what you would imagine. You know, I'm experiencing symptoms. Should I? Can I get tested right now? Should I go to my provider? And you know, the standard answer is you need to call your doctor, or if you're going to go to urgent care or the hospital, call and tell them, I have these symptoms, I want to come in, so they can be prepared for you when you get there. Make sure that all of the doctors and nurses, medical staff have that proper PPE on. That's a big problem. We saw initially with St. Luke's, the first case that went in there, the medical staff has a totally different standard for what PPE they need to have on when they're dealing with someone. They need full Tyvek suit, N95 mask, gloves, the whole bit. If they don't have that on, they're considered exposed. So you're knocking out medical staff left and right. So you can't have that, and that's why these remote testing facilities started popping up, because you couldn't have one guy come in and take out 20 healthcare workers. So we've seemed to have gotten a handle on that, but that's why it's important to call before you go. And I know Orange Regional has a tent set up outside. A lot of facilities are doing that. And if we get Anthony Wayne up and running, that'll take some of the stress off the hospitals also.
Okay. The last question: our first responders, are they under what circumstances should they be wearing masks or respirators?
Well, what we're asking for, first, if we get any calls into 911 that indicates a person's calling for EMS or some type of medical situation, we have inserted some questions into the prompts. You know, have you traveled to, now it's outside the county, what symptoms are you experiencing? So we can draw some information out prior to dispatching emergency services. So we're giving that to EMS, and then even when EMS gets to the scene, the guidelines are have one of your members fully PPE, put their personal protective gear on, go in, assess the situation, so you don't have to mask up 3, 4, 5 people, because now all of that stuff is now gone. It's, you know, it's a single-use type stuff. So the police are a little more different because it's a more dynamic situation where the call isn't a medical call. It's husband and wife fighting. It's a domestic. You get there and holy cow, the wife is sneezing and coughing and it's a mess. The better solution there is make sure you get a mask on the person who is suspected of having these symptoms, and then get your PPE on also. But the mask on the person who's experiencing the symptoms is more effective because you're keeping that droplet that comes out on sneezes and coughs inside the mask of the suspected infected person.
Okay.
I have one quick question. To sum it up, what would be the most important thing that you want the public to know about during this crisis, as what we know today, as far as what we know today? And you can answer Chris again.
Yeah, I mean, it's really, you know, it's such a difficult thing for, I sympathize with the parents. The kids are home from school, and now the kids are all home. So what do they want to do? They want to go hang out with their friends, and they're congregating again. So that defeats the whole purpose of closing the schools. It's really that social distancing, that isolation. If you're going to go into a large group, you risk that group getting infected until we can get a handle on this. So it's going to be difficult for the next couple of weeks because bars and restaurants are closed. We really don't want the kids going out in groups. So that's really the main message is, you know, try to stay in the house, try to socially isolate. Let's let this thing play out, and hopefully we can get a handle on it in a couple of weeks and get back to normal.
Perfect. And could I have your name and title, please?
It's Commissioner Brendan Casey, Department of Emergency Services for Orange County.
Perfect. Thank you very much, sir.